Bismillahirrahmanirrahim. Uh, Quote of the day is every act of kindness is charity. Assalamu alaikum. My name is Dr. Aamna Khalid. I am PGR Community Medicine, and today I will be presenting on the topic of iodine deficiency under the kind supervision of my supervisor, Professor Dr. Saira Afsal. The learning objectives of today's presentation will be a brief overview of the endocrine disorders, then the iodine uses in human body, iodine deficiency disorders spectrum, its diagnosis, management, and prevention, global health issue, national burden, recent advances, and then the MCQs. Here is a case scenario. A 38 years old woman, originally from Lebanon, who had thyroid goiter, was referred by her primary care physician for evaluation. The patient recalled having a goiter for at least 1.5 years and underwent biopsy of a left thyroid nodule as well, which was negative for malignancy. Her dietary history indicated avoidance of iodized salt and seafood by choice. Her sister also had a thyroid disorder of an unknown type. Diffuse goiter was palpable upon examination. Values from the laboratory tests were normal TSH, normal thyroid function, but her 24-hour urine iodine level was 90 microgram. Ultrasonography of the thyroid tissue showed a diffuse goiter, so a diagnosis of iodine deficiency was made. Uh, this is just an overview of the endocrine system that we already know from the knowledge of physiology. There are different glands like adrenal, medulla, cortex, the pineal gland, hypothalamus, then the parathyroid, thyroid, and pancreas that are releasing different hormones in the body, as it's shown in this flow chart. Then a very brief overview of the endocrine disorders. Like in case of pituitary gland disorders, either there is a decrease in the diuretic hormone production that can lead to diabetes insipidus, or either there will be too much ADH and it will lead to SIADH. In case of pancreas, either the insulin receptors are not working properly, and in the case of complication of type 1 diabetes, it can lead to DKA. And in case of the complication of type 2 diabetes, it can lead to HHNS. Then the adrenal gland disorders can include Addison's disease, in which cortisol is not produced in the enough or required amount, and in the Cushing's disorder, there is too much cortisol in the body. Then, in case of thyroid gland, if the thyroid hormone T3, T4 are less, then it leads to hypothyroidism, and if it's too much in the body, then it leads to hyperthyroidism. In case of parathyroid gland, again, if the parathyroid hormone is not enough, it leads to hypothyroidism, and if there is too much parathyroid hormone, it will lead to hyperthyroidism. So moving on to the major topic, the main focus is on the iodine deficiency today. So a healthy human body contains 15 to 20 milligram of iodine, and 70 to 80% of it is present in the thyroid gland. Other than thyroid gland, the remaining iodine is present in the mammary tissue, in the prostate glands, in pancreas, gastric, and nervous system. So iodine is found to have a suppressive effect in benign breast disease and also benign prostatic hyperplasia. It plays a vital role in the growth and development of the fetus. Most of its organs, especially the brain of the fetus. Iodine deficiency remains the single greatest cause of preventable brain damage and mental retardation worldwide. Here in this diagram, it's shown that how iodine is incorporated into the thyroglobulin, and our T3, T4 hormones are produced and then released into the bloodstream. So iodine, as we have mentioned, that is majorly present in the thyroid gland. So it's a essential component of T3 and T4. So now these thyroid hormones regulate many important biochemical reactions like protein synthesis, enzymatic activity, and are critical component of metabolic activities. And they are also required for proper skeletal and central nervous system development in fetus and infants. Sources of iodine are fish like codfish and tuna, seaweed, shrimp, and other seafood. Then the dairy products like milk, yogurt, cheese, and eggs. Then iodized salt, which is readily available in many countries. This is the recommended dose of iodine intake recommended by WHO. For children aged 6 to 12 years, 120 microgram per day is the requirement. For adolescents and adults, 150 microgram per day is the requirement. And for pregnant and lactating women, 250 microgram per day is the requirement. There can be a number of causes that lead to iodine deficiency, like the soils from mountain ranges, like our country, the northern areas, and then the areas with frequent flooding. Uh, Food grown in such iodine deficient regions, protein energy malnutrition, ingestion of goitrogens, contaminated drinking water, bulky high residue diets that interfere with absorption of iodine, use of fertilizers, and intensive cropping, all of these can lead to iodine deficiency. This was a news published by WHO that due to the increasing popularity and availability of plant-based alternatives to key sources of iodine such as milk, dairy, and fish, all of this is contributing to persistent and increased insufficient iodine intake. So the risk factors include selenium deficiency, pregnancy, exposure to radiation, goitrogens. Women are more prone to have iodine deficiency. Smokers and those taking perchlorate or thiocyanate. So iodine deficiency disorders. In inadequate dietary intake of iodine can lead to insufficient production of thyroid hormones. So that will affect many parts of the body, including muscle, heart, liver, kidney, and the developing brain. So the inadequate hormone production will now adversely affect all of these tissues, and there will be a spectrum of disease that's called iodine deficiency disorders, IDD. So the spectrum in case of fetus include abortions, congenital anomalies, endemic cretinism, stillbirths, increased perinatal mortality, and deaf mutism. In case of neonates, it can cause neonatal goiter, neonatal hypothyroidism, and endemic mental retardation. In case of children and adolescents, it can cause goiter, then hypothyroidism or even hyperthyroidism in the later cases, impaired mental function, retarded physical development. In case of adults, the spectrum of IDD includes goiter with its complications, hypothyroidism, impaired mental function, and again, it can lead to hyperthyroidism as well. So now moving on to the goiter. What happens that iodine deficiency stimulates TSH secretion from the hypothalamus, which results in the thyroid hypertrophy. So the enlargement of the thyroid gland due to dietary iodine deficiency is called the endemic goiter. If iodine intake is consistently lower than 50 microgram per day, that can result in goiter, and large goiters can cause choking and difficulty in breathing. In case of severe and prolonged iodine deficiency, it leads to now deficient supply of thyroid hormones. So now the condition will be hypothyroidism, and the symptoms of hypothyroidism includes poor ability to tolerate cold, extreme fatigue, muscle aches, constipation, slow heart rate, depression, weight gain, swelling and thickening of the skin. That's called myxedema. Endemic retinism in children includes the symptoms like severe and irreversible mental retardation, deaf mutism, short stature, reduced muscle tone and coordination. Child will be unable to maintain posture and balance and will have a characteristic walking style. Sparseness of hair and nails, voice will be hoarse, skin will be thickened, tongue will be enlarged, protruded abdomen, and umbilical hernia. Myxedema crisis. It's a rare but life-threatening state of extreme hypothyroidism, and it may develop with some acute illness like the infections, and it can be the first presentation of hypothyroidism. And the symptoms include low body temperature without shivering, confusion, slow heart rate, and reduced breathing effort. So the patient can present in emergency with such symptoms. Insufficient iodine intake during pregnancy can lead to lasting brain damage that reduces a child's IQ by 8 to 10 points and up to 13.5 points in case of severe deficiency, with marked impact on children's learning ability and school performance. How to diagnose iodine deficiency? Uh, the mainstay is the median 24-hour iodine urine levels. Then the thyroid function test and 24-hour radioactive iodine uptake and biopsy of the thyroid tissue can also help. So, monitoring the iodine deficiency is also by the median urinary iodine concentration, and these are the levels of the iodine concentration in urine recommended by WHO. That in pregnant females, the adequate level should be from 150 to almost 250, and in lactating females, it will be adequate when it's more than 100, and in children less than 2 years of age it will be again adequate when the level is more than 100. So less than 100 is insufficient. Once hypothyroidism is developed, now what we can do is to give thyroxine tablets to the patient. And in case of goiter, if the goiter is large and symptomatic, then thyroidectomy is the surgical option. How to prevent the problem is by iodine-rich diet, ingesting iodine salts, iodine supplements like in the form of an oral solution of iodine such as Lugol solutions. Food fortification with iodine is important, like bread is fortified in some countries or milk, water and salt. So universal salt iodization um, is the most effective strategy adopted by WHO. While running this universal salt iodization program, there are a number of things we need to keep in mind. That is monitoring and evaluating this IDD control program to ensure that the salt industry complies with the regulations set by the government. Reinforcing the collaboration between sectors, like a national multi-sectoral IDD body should be chaired by the Minister of Health himself. International resource laboratory network should supply the technical support and human resources. Sustainability of this IDD control program is important, and public health authorities should remain mobilized, and salt industry should effectively monitor iodine content. There are a number of challenges in IDD control in Pakistan on the level of national policies and plans. The policies are lacking in sustainability of the program. There is lack of government funds. Salt industry is a less priority among the governments. No national legislation is in place for mandatory salt iodization. Provinces have no harmonized approach. At the level of management and monitoring, there is absence of any designated nutrition officers at the district level. Quality of iodized salt produced by small-scale producers is less than satisfactory. Limited information on use of iodized salt in processed foods is present. And a lack of a recent efforts to ensure the awareness of iodized salt and its benefits, and absence of a regular and systematic mechanism for tracking iodine in household salt and urine. Global burden. At a global scale, approximately 2 billion people suffer of iodine deficiency, of which approximately 15 million present with the clinical manifestations. This is the map showing global iodine status. The countries shown in green color have adequate iodine status in the school-going children, and the countries shown in pink are insufficient in its iodine status of the children. As per the data of 2021, the household consuming salt with iodine on the global level, its percentage is 89%, and in Pakistan, its percentage is 79.6%. And in South Asia, we can see that the percentage is 89.7%. Like 89.7% households are using iodized salt. This is the provincial breakdown of our country. You can see in this slide that Gilgit-Baltistan, that's the mountain areas, have the highest percentage, 91% households are using iodized salt. But here in the next slide, you can see that Gilgit is still lacking iodine nutrition among the school age going children and women of reproductive age. So this is the progress of iodine status and controlling the iodine deficiency from 1980s in our country till 2018. In 1980, there was a launch of multiple salt iodization initiatives. In 1980 to 1990s, there was high prevalence rate of goiter and inadequate iodine intake among school-going children. In 1987, there was initiation of iodized salt supplementation, and it went till 1993. In 1994, implementation of IDD control program was done. In 2005, this salt hydration program was revitalized with the technical and material support, health department support, and mass awareness campaign. In 2013, there was phasing out the free donation of potassium iodate and establishment of a revolving fund to manage the distribution of it on no profit, no loss basis. The graph shows the blue line shows the school age children and their iodine status. And the purple one is showing the women of reproductive age, and the orange one is showing the pregnant women. The one below in the blue color shows the household use of iodized salt. It has increased from 17% to almost 80% from 2000 to 2018. This article was published in the Nutrients Journal, and it states that the effects of iodine supplementation in pregnancy and iodine status, thyroglobulin levels, and thyroid function parameters, and it was a randomized controlled trial conducted in a mild to moderate iodine deficiency area. This article was published in 2020. The effect of nutrition education on iodine deficiency disorders and iodized salt intake in Southwest women. It was a randomized controlled trial again, and it showed that how the nutrition education improved the status of iodine deficiency. This article was published in 2018. The regional influences on nutritional iodine status of pregnant women in Pakistan. It states that rural urban disparities were observed only in the socioeconomically disadvantaged districts, and these disparities limit the effectiveness of the IDD prevention program in rural areas in Pakistan. This implementation of mandatory salt iodization requires improvement, and program effectiveness should be continuously monitored. These are the organizations working for IDD control, including WHO, UNICEF, World Food Program, Nutrition International, Iodine Global Network, International Council for Control of Iodine Deficiency Disorders. 21st October is the Global Day for Iodine Deficiency Disorders Prevention Day. So the key message after all this presentation is that iodine deficiency greatly affects children and pregnant women. Iodized salt is the mainstay of prevention, and using the iodized salt needs to be addressed by health education, and that's significant. So now it's the time for MCQs. Question number 1. What is the most appropriate method for diagnosing iodine deficiency? Option A, serum iodine levels. Option B, urinary iodine concentration. Option C, thyroid hormone levels. Option D, goiter prevalence surveys. Option E, physical examination.
A.
Option B, urinary iodine concentration, and that's mentioned on the slide number 25. Question number 2 is, what is one of the main control measures for preventing iodine deficiency disorders? Option A, public health campaigns. Option B, increased consumption of dairy products. Option C, iodine supplementation. Option D, mandatory iodized salt use. Option E, using iodine in fertilizers. Main control measure. Option D, mandatory iodized salt use. The program control program run by WHO all over the world. Question number 3. What are some common sources of dietary iodine? Option A, fruits and vegetables. Option B, red meat. Option C, fish and dairy products. Option D, whole grains. And option E, water. Option C, fish and dairy products. Question number 4 is, what is the recommended daily intake of iodine for pregnant women? Option A, 300 microgram. Option B, 220 microgram. Option C, 250 microgram. Option D, 150 microgram. And option E, 100 microgram. Option C, 250 microgram is the correct answer. Question number 5. A pregnant woman in a rural area of Pakistan presents with symptoms indicating potential iodine deficiency. She reports limited access to iodized salt and consumes mainly plant-based foods, which are low in iodine. Recent studies show high goiter rates in her region despite ongoing iodine supplementation programs. How does iodine deficiency during pregnancy affect thyroid function? Option A, it impacts only the mother's health, not the fetus. Option B, it greatly increases thyroid hormone production. Option C, it does not significantly affect thyroid function. Option D, iodine deficiency can cause hypothyroidism and affect fetal development. Option E, none of the above. Option D is the correct
D.
answer. Yes, option D is the correct answer. Question number 6. A male baby born in the setting of public hospital through C-section after 4 months, the mother presented with a complaint of yellow-colored skin, along with the lethargic baby who is having delayed developmental milestones. Mother was deficient from iodine throughout the pregnancy. Iodine deficiency in a baby could result in option A, cretinism, option B, hypothyroidism, option C, chronic hyperthyroidism, option D, thyroiditis, and option E, Graves' disease.
A.
Yes, option A is the correct one. Question number 7. When the progressive enlargement of a multinodular goiter causes symptomatic tracheal compression, the typically preferred treatment management in otherwise good risk patients is option A, radioactive iodine treatment, option B, thyroid hormone treatment, option C, iodine treatment, option D, surgical resection of abnormal thyroid, option E, iodized salt.
It could be D. Surgical resection.
Yes, surgical resection is the correct answer. Question number 8. Which of the following is not a risk factor of developing iodine deficiency? Option A, selenium deficiency. Option B, pregnancy. Option C, goitrogens. Option D, OCPs. And option E, fish intake. Option E, fish intake is the answer because it is not a risk factor, but it is actually a source of iodine. Question number 9. A woman presented to emergency with cold extremities and confused state. Her BP was recorded as 100 by 70, pulse was 49, and respiratory rate was 10. She also had a neck swelling on examination with a complaint of dry yellow colored skin of lower legs along with itching. What do you suspect this patient was suffering from? Option A, Addison's disease. Option B, myxedema crisis. Option C, circulatory shock. Option D, subdural hematoma. And option E, respiratory failure.
B.
Yes, option B is the right one. Question number 10. Which of the following is not a possible cause of iodine deficiency? Option A, intensive cropping. Option B, frequent floods. Option C, mountain ranges. Option D, fish and dairy products. Option E, alkaline fertilizers. Option D is the correct one. Fish and dairy products are the source of iodine. So this is the MCQ's key. This is the YouTube channel on which this presentation will be uploaded. Thank you so much.